Hello, it's Dr. Rhonda Johnson. Today is Sunday, July 16th, 2023. Today I'm talking about vision screening for your kids. Now, if you've got school-age children, you may be thinking about all the back-to-school preparations you have to do. So my message today is a reminder to add an eye exam for your child or young adult to your list of back-to-school preparations. And I want to ask you, has your child or teen had an eye exam? So what do I mean by an eye exam? There's generally two types, vision screening and a comprehensive eye exam. Now, most doctors' offices and many schools provide vision screenings, and that generally tests distance vision and how well you can see. And typically, they'll refer that child or young person to a specialist if any issues are detected. I know that's my first memory of my vision screening at school in the first grade when I found out I needed eyeglasses. And for many children, that will be sufficient. But some children may need a comprehensive eye exam. A comprehensive eye exam diagnoses eye disease, and this is typically done by an eye specialist called an ophthalmologist or an optometrist. Now, the American Academy of Ophthalmology advises parents to seek a comprehensive eye exam if their child fails a vision screening or it can't be done, it's inconclusive. If they're referred by a pediatrician or family doctor or a school nurse, or if the child is at risk for developing eye problems. You know, there's certain conditions such as prematurity, juvenile arthritis, trisomy 21, commonly known as Down syndrome, or if they have a family history of eye disease or conditions. Now, parents, if your child has a learning disability, been diagnosed with developmental delay, neuropsychological conditions, or behavioral issues, they may need an eye exam as well. So what age do you start vision screening? Well, the American Academy of Pediatrics recommends that vision screening start around age 3 and occur every year at 4, 5, and 6 years. Again, some children may need eye exams by an eye specialist early, depending on their medical or family history. Now, there is a powerful connection to vision and learning. That's why I started off talking about school, putting this on your back to school task list. Did you realize that 80% of most classroom learning is visual? Now, of course, this doesn't apply to instruction that's adapted to blind persons or people with extremely poor vision that are receiving adaptive services. But vision problems such as eye coordination, eye focusing problems can make learning difficult because they can make the words appear blurry or double or look like they're moving on the page. So what are some signs that your child may have a vision problem? As pertains to learning and interfering with reading, things like difficulty completing homework, or your child loses their place when reading, skips words, skips lines, their eyes feel uncomfortable, tired, or sore when they're reading, or at home if you notice that they're looking at their screens close up, they're standing real close to the television, that ought to be a red flag that they need to get their eyes examined. So in closing, parents, caregivers, please put that vision check on your task list of back to school, things to do as soon as you can. You may not be able to get that eye exam before school starts, but get it in as soon as you can. That's my message today. As always, be well and take care.